Every day was a new horror.
Heather Tyler says she gets a sick feeling thinking about her husband's brief stay at Westport Rehabilitation and Nursing Center.
Absolutely pitiful, disgusting, deplorable. Any words you can think of that's horrendous is the word for it.
She took Earl Tyler to the Henrico facility in January as he dealt with Alzheimer's, narcolepsy, and incontinence.
I mean, you can see the marks on the walls and the dirt on the edges.
But she says she instantly became concerned with the cleanliness of his room, snapping these photos of the conditions. And one day, she says she found Earl covered in his own urine.
He's sitting there and he's holding his leather belt in his hand, and it's like dripping. And I'm looking at him. It was the same clothes I had put on him at 11 o'clock the day before, the same Depends I had put on him at 11 o'clock the day before. He was soaked from his elbows to his knees.
She says her worries escalated after discovering Earl had fallen 2 times and on one occasion was unable to move his hand, prompting her to take him to the emergency room.
And he reached out and his hand was kind of like curled up and it was quivering as he reached out. And it was, what the hell happened to your hand?
The final straw, she says, is when she found these marks on his body. She alleges staff members were unaware of them and could not explain them.
I was really so angry, so incredibly angry. I just cried. Cried.
After just 19 days, Tyler removed her husband from the facility. Shortly after, she filed a complaint with the Virginia Department of Health. That was in January. It's now September, and VDH has not taken any action on her claims.
Get off your rear ends and do something about this. Something. Make people responsible. Make them accountable.
He was lying in a prone position. As you can see, the hospital gown is barely on him. It's on one shoulder.
Her concerns very similar to Steve Lambert's. Last month, CBS 6 reported that it took VDH 8 months to investigate complaints that Lambert submitted about the same facility.
I found it very disheartening that the Department of Health had not responded.
Tyler saw that story, and she felt compelled to speak up too.
It was like a godsend. I thought, wow, someone has led me. This is a divine intervention that someone said, turn on this TV and turn on that channel.
Federal investigation standards separate allegations by priority, and complaints assessed even at the lowest severity levels should be addressed within 45 days or as a focus area during that facility's next on-site inspection, which Westport has had at least 2 of since Tyler submitted her complaint. But as we previously uncovered, VDH has a 40% vacancy rate of long-term care facility inspectors and has the 4th highest percentage in the country of nursing homes overdue for recertification, at nearly 70% of them. The Centers for Medicare and Medicaid Services says states like Virginia struggle because Congress has not increased funding for its inspection program in 9 years, despite a sharp increase in complaints, leaving agencies under-resourced.
What can I do to get you money?
Tyler says she's already been on the phone with several leaders in the health department, including the licensing director who oversees all of this.
And everybody just keeps saying, we need funding, we need people, we need funding, we need people. Isn't that what senators are for?
She even wrote to Senators Tim Kaine and Mark Warner and Governor Glenn Youngkin, and she's now sending letters to her state lawmakers, advocating for more oversight and action.
Everybody can tell you a horror story about this, and yet it's accepted. Or it's just, oh, that's awful, and nothing happens. It's damn awful, and something has to be done.
We reached out to Westport multiple times asking for a response to Tyler's allegations, and we have not yet heard back. A spokesperson for VDH tells me that they do not have an update on the status of Tyler's complaint. Now, as we continue to follow this story, I've contacted several state and federal leaders asking what are they doing to help fix this oversight system. I'll share their responses in that part of our story in a new report on Thursday. I'm Tyler Lane for CBS 6 News.
The information and the findings that came to light within the investigation were so disheartening and they were actually scary.
Charlene Riley, a mother of 3 children in Richmond Public Schools, describes her reaction reading the third-party investigation report into the Huguenot High School graduation day shooting.
I'm outraged, and mainly I'm shocked because we knew that administrators and teachers, and we knew that the school counselor and at least the principal were aware of the threats that were being made, and they chose to ignore them.
The report revealed numerous Huguenot High School staff members were aware of a multitude of safety concerns surrounding Sean Jackson, the homebound student who was shot and killed after the June 6 ceremony. It says his mother warned his counselor that being physically in school was very unsafe, that Huguenot students shot up their home, and that kids literally tried to kill him. Despite this, investigators found that school staff never completed a threat assessment, did not escalate security issues, and allowed Jackson at the graduation against required authorizations and without any consideration of known safety concerns.
Right now, I would like immediate accountability from the superintendent, and the school system is failing the students. They're bringing the violence and the things from in the streets into the school.
CBS 6 has identified several inconsistencies in information that was originally released to the public by RPS versus what we know now. Superintendent Jason Cameras' first report said that a counselor approved Jackson's graduation attendance as a designee of the principal, but investigators found the counselor never even spoke to the principal. Cameras also told school board members that Jackson was homebound for mental health reasons, but investigators found he was also homebound due to the threat of neighborhood violence. And RPS told me in a July statement that they acted in accordance with protocol by not completing a threat assessment prior to Jackson's attendance at the graduation because, quote, there were no reported safety concerns. However, investigators found that staff failed to initiate a threat assessment based off information that should have triggered one per policy. Do you think that, there was misleading information that was initially put out?
I'll say at this point that initial report seemed very incomplete, especially to those of us who experienced the event, which is why we reached out to get, someone to do a deeper investigation.
School Board Chair Stephanie Rizzi spoke exclusively with CBS 6 Thursday. She initially fought the release of the report, citing a desire to protect the identities of RPS employees who participated in the investigation and were promised confidentiality.
And from what I'm hearing, there are a lot of upset people now at Huguenot and district-wide. Because we didn't deliver on that promise.
How do you expect that the board and the administration will be moving forward from this as far as any accountability measures or continued improvements to procedure and safety?
There are going to be definitely, we're going to take a really close look at procedures. We, the district has invested in a lot of security devices and initiatives that we will start to definitely implement immediately. In terms of specific accountability, I can't answer that. I don't know.
Do you believe that there are internal operational gaps, and as you guys move forward, that's something that you have to address?
I think that there are a lot of operational gaps. I think that there are really, honestly, cases where, employees are not sure exactly how to report things, who to report them to, what the actual chain of command is.
Do you think that this could have been prevented?
I talk to a lot of people about that, and most of the people I talk with say that, if someone is bent and determined to do something like this, they will most likely find a way. What I can tell you is that on the RPS side, we will work as hard as we can to tighten protocols, to look at our policies, and to look at what happens on the ground to make sure that we do everything we can to prevent something like this.
Now, regarding some of the inconsistencies between the two reports about the incident, an RPS spokesperson said that previous initial statements were made in real time as investigations were developing. They say at the time they thought they were providing the most accurate and complete information, but they apologized that it wasn't completely accurate. They were working with limited time and resources. In Richmond, I'm Tyler Lane, CBS 6 News.